I wish I could say that all children are born on an equal playing field, but I don't think that's always the case. It's harder to live healthier here. We don't have the same access to inexpensive but healthy foods. We see really high rates of diabetes and obesity in our community.
So one of the challenges our families face is that we have very limited access to healthy foods and clean water. The Navajo Reservation is about the size of West Virginia, spread across 3 different states, and being that big of a size and only having 13 grocery stores on it is a very big challenge for our people here.
This is the only project in the area. The intervention is aimed at moms with infants. We're trying to get them the education as soon as possible, as early as possible, before baby even is eating anything other than breast milk and formula. So them knowing ahead of time when baby is 3 months not to put the Kool-Aid in the bottle, that's gonna make a difference.
When you visit a participant in their home, you're really in their space, really get a sense of what's going on in their life and what they need help with. And the more you visit them and the more they become comfortable with you, it can really help let you know what it is that they need. It's a really neat model.
The Family Spirit Nurture Project is an excellent tool to be able to provide home-based services for my patients. Early home visitation programs have been proven to be very important and one of the most effective tools in combating all sorts of illnesses. I'm really glad that this program is doing that. It is so helpful for our patients and families.
I'm a first-time mom and I didn't know a lot of things until she told me some information about what babies shouldn't have and a lot of things that deal with healthy foods. And I'm pretty sure anybody wants to make sure that their baby's healthy.
There is a need for the clean water delivery just because of such limited access to water. They could also start turning towards sugary drinks instead just because they are cheaper, they are more convenient to get at stores that are nearby. So it's best that we are able to offer our free water delivery system to the families just so that they have access to water for the whole family.
The Family Spirit Nurture program helps families educate themselves more about what they're feeding their kids and what they're putting into their bodies. I usually get my water at Walmart, but now I'll be getting my water from the Family Spirit Nurture program.
The education is starting at infancy so that we're really trying to give the babies the very best chance that we can give them to reduce their risk for obesity, diabetes, tooth decay. As a community, it's all of our responsibilities to try to stop that from happening.
We as family health coaches believe that from pregnancy to 24 months is a critical time in a baby's life. If we can get baby on a growth trajectory by the time he or she is 2 years old, it can reduce the risk for obesity and chronic disease for the rest of baby's life.
As a Navajo woman, being able to help other Navajo families, it's indescribable.
Knowing that my work I do has a greater impact on the families, I feel like that's what I live for. And I want to show other people that we are able to do this and we can help ourselves. We are people who can do it.